it's Dr. Shabby here with Ask Our Experts. Okay, so today I have a new expert with me.
Hi, my name is Letty Brixey and I'm a massage therapist.
Yeah, so Miss Letty, you do massages.
Yes.
You do prenatal massages.
I do.
Yeah, so it's okay to get massages during pregnancy?
Absolutely, unless there's been any restriction from your providers, absolutely get on the table.
Okay, so let's talk about that. I know a lot of my viewers are moms, whether they're pregnant or postpartum. So let's start with a little bit of prenatal first.
Yes.
What are the benefits of getting massages throughout your pregnancy?
Just like the benefits that you yield from massage when you're not pregnant, they're even greater when you are pregnant. So improved moods, improved sleep, even addressing specific areas where you're experiencing pain with proper care and kindness and nurturing, we can address those issues and help get you some relief during it's what's supposed to be the happiest time, just to get you some relief, because there can be some uncomfortable moments during these months.
Some uncomfortable moments during pregnancy. Okay, so how does your table accommodate to a pregnant person?
So we can do massage in a few different ways. I have cushions that will allow you to lie on your stomach from the second you're pregnant.
Nice.
So that way it can allow for breast comfort, because sometimes that's the most tender area right away. And then there's space that we can adjust for your belly. Or we can position you lying on your side, kind of like the way that you sleep, and we prop you up with comfy pillows and cushions. Or I have a great big giant, I like to call it the boat, and you can lie on your stomach, but there's no pressure on your belly. Supported for your breast, supported for your belly, and it's just like receiving a regular massage, and it just, for a little bit, you've got that weight of your belly. As much as we love it, that weight can can start to cause some issues, so it's a nice break from that as well.
Especially that third trimester, towards the end, you're kind of waddling and things are uncomfortable. It is so real, yes. Okay, so how early, when a mom finds out she's pregnant, can she start getting massages?
I'm comfortable doing massage as soon as you know that you're pregnant.
Okay.
As long as there's not been a history of any complications with pregnancy or a history of pregnancy loss, I'm perfectly fine, because I also believe there's not anything that I can personally do that's gonna make I can't make your body do something it wasn't already going to do. But I still, if you have any reservations or hesitations about getting on the table, then I would talk with your provider, or wait until your second trimester. That's a lot of folks do that. But you also need to be comfortable. I'm comfortable doing it, like I said, discussing your history. But I also want you to be comfortable, because I don't want anyone to ever feel like they have to get on the table when they're not ready.
The whole time.
Yeah, because then it's counterproductive.
100%. And then so now let's go into postpartum a little bit.
Yes.
How soon after having baby can a mom come in?
Almost immediately. Again, just depending on the kind of delivery that you had.
Okay.
If everything went well and you're home hours after delivery, then we just proceed cautiously. I just really try to pay attention to you and your needs. And we just kind of go gently through there. I mean, we're not going to like dig in and do deep tissue, but just more of a kind, nurturing touch and just supportive care.
And if obviously they've had a C-section, and be a little bit longer after.
Yes. And then I would also want to just be sure that the doctor has cleared them to be on the table, if that's the case. I'm always happy to provide massage and to support you in that way, but I also want to proceed with caution and safety. Ultimately, so if I ever ask for doctor's permission or release, that's just because I have your best interest in mind.
Definitely. Okay. Now talk to me. Obviously, you see all sorts of moms, so delivering home, birth center, hospital, right? Variety of locations. Have you done a birth center or a home birth massage? I lost someone as a labor.
I haven't done a birth center massage, but I have been called in when someone was in labor and it kind of stalled, and I just kind of quietly set up my table, and mom is in full labor and in pain, and I'm just like, all right, and I just kind of meet her where she is. If we can get her to the table, that's fantastic, and if not, I just work all the areas that I know that can contribute to some of the pain that she's feeling with those contractions. So yes,
that's exciting.
It was very exciting, and it's a privilege as well to be brought in during those intimate moments, because it is a very intimate time.
It is a very intimate, and it's so sacred on who you have present.
Yes.
I feel like after my labor, that's something I learned, is be really 100% sure of who you want present.
Yes,
because it can definitely make or break your
Yes. Yes.
Okay, so so that's a little bit of that. Let's talk a little bit about lymphatic. lymphatic flow. Will you tell me a little bit about that with like massage and benefits of kind of, I guess, I hear patients say, oh, I want a lymphatic massage.
Well, I personally don't practice lymphatic massage, but I know anytime you are manipulating the muscles, moving the body around, things are going to start flowing.
Yes.
Things get stuck and sticky, so we can work through and unstick those layers of tissue, which will allow more blood and fluid to flow. And I, can work.
But that's not something you do during pregnancy.
I don't do it during pregnancy, and it's not a like lymphatic massage specifically. It's not something that I like practice, and I'm not like I couldn't confidently say, oh, I'll do lymphatic, and this is all the things that it's going to benefit. I think any touch in a skilled, mindful way can be beneficial.
Sure.
I can refer you to folks for some lymphatic drainage if that's something that you're interested in.
Tell me a little bit about, for example, deep tissue during pregnancy.
Deep tissue during pregnancy, again, it's working within the mom's limits and tolerance. A lot of times when there's low back pain, the sacrum can be a source of pain, but with an appropriate amount of pressure, we can also help, I'm not going to say eliminate, but we can at least reduce it and give some relief. So just always working within a mom's pain tolerance and comfort. Absolutely.
Yeah, that's something I try to teach my patients is, they're used to certain techniques and treatments prior to pregnancy, and then they kind of want the same journey.
Yes.
So I always try to teach them, I'm like, I know you love deep tissue, but it's not always the best during pregnancy because as you work on, even a lymphatic massage, as you're working on the mom, you release these toxins from the body, right? So I say, guess what? Now you have baby, and there's no studies that really show what that's doing to baby.
Right.
So I really try to teach them, see someone who's trained or who's skilled and has practiced with working with a pregnant mom, because they know how far to push and when to stop. Because I feel like that's the most crucial part of knowing when too much is too much.
Absolutely. So communication is always key.
Yeah.
And just, checking in. And I always advise the moms anytime they feel any kind of discomfort, any pain, nauseous, just something is not right.
Yeah.
I encourage them to speak up, because we can change positions or we just stop.
Yes.
Because then there's nothing wrong with that. And so there have been a couple of times a mom's like, I don't feel so good, and we just change positions, take a break, and they feel okay, and we continue, or we just stop.
Yeah, definitely. So. Okay. So tell me what your experience is from a massage therapist standpoint and working with patients who get chiropractic care throughout their pregnancy and they're getting massages.
So I've been licensed since 2007, practicing off and on with as life demands, because I have a couple of kiddos of my own, which is nice. But I've noticed a difference in moms' flexibility, their stamina, their overall movement. I've been able to see them regularly, and I know that they've been receiving chiropractic care. They just feel better, even though there are some pains. They still just feel a little bit better, and know that they've got some resources to help them and support them, which I applaud every time, because once you become a mom, it kind of feels like some of those self-care things get set aside. So I'm always very encouraging and applaud moms when they're able to do that. I'm guilty of it myself, so that's a goal I continue to work on.
Yes, that's something I used to say, when I become a mom, like, I'll definitely do self-care.
Yeah, definitely.
And and then I've had my son, and I've had one massage in the last 9 months.
I've only been on the table because I was in training.
There you go. See, so it's, it's one of those you truly just forget about yourself, and you're in this go 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 mode. So I see moms throughout pregnancy, and then afterwards they have baby. They bring baby in, and I'm like,
hello. Yes.
So are you coming in? Because so I always say, I'm like, when's the last massage you had? When's the last adjustment you had? And it's because people forget about themselves. And I think it's like, I don't know, something happens. You give birth to this baby, and then you just poof.
Yeah, so there's a lot of guilt, and there's a whole psychological, there's psychology all behind that, and studies, I'm sure, but there's always guilt. Even my kids are 11 and 8, and to do something for myself, even though it's totally fine, I still am like, what? I'm not doing this.
Yes, what are they doing? Okay. So tell me, if someone, obviously you're here in San Antonio, so you can treat mamas here. If someone was not here, they're either out of city or out of the state, where would they go to find a massage therapist?
I would start with your providers, your obstetrician, your doula, your midwife, your chiropractor. Just check in with them and see if they have someone that they trust and they would recommend. Talk to your friends and family. If they have a massage therapist that they like, then you can interview them. talk with them, find out what kind of experience they have with prenatal massage. I feel like word of mouth is often the best way to find that, and so talking with those professionals and those folks that are close to you is a great place to start.
I agree. That's it's definitely something we do here at our office. It's
Yes,
once you build the trust, you know, it's I know someone's technique and I trust them to be able to take care of my patients. And I know that's my name behind it.
Right.
So, especially as a provider, when you make that referral, you're hyper alert in a way, I guess, because you wouldn't send to someone that you wouldn't go yourself or trust your family to go to. So, that is a great resource. Definitely asking around is good. Okay, is there anything else, any tips, tricks, anything you'd like to give our viewers watching?
I would just say, if you feel like you need to get on the table, then get on the table and make the time for yourself to do that. If you have any questions, any comments, any concerns about that sort.
What do you, I'm going to actually ask you a question. What do you recommend, like frequency to look like throughout pregnancy?
Gosh, frequency probably weekly would be ideal in some cases, but I think a lot of moms that I've worked with, they'll do once a month for the first few months, and then as we get closer, once a week, and depending, you know, maybe even a little closer if there's a particular area that's giving them a hard time. But it's really just you listening to your body and knowing how you respond to massage and to being adjusted, and just kind of take a cue from there. I try to be super flexible with my availability and my scheduling with moms, and know that things come up. So I just really encourage you, it helps you with the self-awareness.
Something I actually recommend is get a massage first and then get adjusted. And the reason I say that, you know, I think sometimes people, I guess, don't see like the reasoning. It's usually, you know, you relax the muscles. That way when you come in, I can actually mobilize you versus coming in super tight, me trying to push through all those muscles to mobilize that joint. And then you go get it loosened, but then now that joint probably already moved, right? Versus you get it loosened, you come and we set it, you get the adjustment, and you let it be. Let your body kind of heal from there. Versus adjusting, getting it loosened, and now you're like, well, I hope it stayed.
That's a great tip.
Yeah.
That is great.
That's my personal preference. Obviously, it doesn't always work in everyone's schedule, which is totally understandable.
Right.
But that's just like my friendly tip of the day.
I'm going to keep that one in mind.
Yes. Okay. If there's nothing else, thank you for being here. If y'all have questions for her, feel free to comment. We'll definitely forward them, and we'll leave her information as well. Okay.
Thank you.
Bye.